Hi, and welcome back. In this short video, we'll discuss the benefits of therapy and family counseling for families who have a child with a developmental delay, such as autism. Counseling also supports the parents who can really be suffering when they face challenges reaching their child. First, it's important to understand that psychological counseling, or therapy is not an effective treatment for toddlers with a developmental delay such as autism. These children need behavioral therapy and intervention. Traditional psychological counseling and therapy typically involves a discussion of feelings and emotions. Toddlers are obviously not ready for that. For parents, however, counseling can help them deal with emotional strain from the significant challenges they face. Parenting a child with a disability can put a strain on marriage and a couple's relationship. More than anything, all parents want to see their child happy, independent, and successful. So they do everything they can to support their son or daughter. However, that can leave you exhausted most of the time. Half the time you question yourself and worry that you're doing something wrong. So much of your life is taken up with trying to advocate for, teach, and support your child. Still, it doesn't seem like you're doing enough. Social situations seem difficult, and there is more conflict in your home than you want to admit. You find yourself putting your child first until you have no energy left for yourself. But you are not alone. A trained and experienced counselor can help. They can understand not only challenges your family faces, but also what has helped other parents with their children. Through either individual counseling sessions or a support group for mothers of children with developmental conditions like autism, you can find the support and guidance you need to be your best you, for your child, for your family, and for yourself. Adolescents and teens with autism struggle with depression, anxiety, relationships, and engaging in activities not part of their restricted interests. Ongoing difficulty interrupting and responding to social cues, relatively low social motivation, and isolation frequently interfere with relationships throughout the lifespan, especially for adolescents. Research shows that individuals diagnosed with ASD are also at increased risk for depression beginning in adolescence when they develop increased awareness of their difficulty establishing peer relationships, a pivotal developmental task during the adolescent phase. In addition to behavioral intervention, psychological counseling and therapy can be very helpful to these adolescent kiddos. If you think counseling may be helpful to you or a family member, you can find a qualified counselor through speaking with your regular nurse or doctor. You are not alone. Some things you should look for in a therapist include specific training and experience in providing therapy for ASD individuals and their families, and a treatment model utilizing evidence-based interventions, such as cognitive behavioral therapy or CBT. Don't be afraid to ask questions about the therapist's background and qualifications. A competent therapist should be able to answer any questions and address any specific concerns you may have. A skilled counselor or therapist understands these unique challenges and can work effectively with the individual with autism and his or her family to improve daily functioning and quality of life. Please remember, the information in this program is not meant to diagnose or treat. It should not take the place of consultation with a qualified healthcare professional.